will tell you from the clinical experience working at different centers. So typically when patients come in, we clinically examine them for any visual field deficit. And if we find that they have a clear visual impairment, we do a clinical assessment and we tell them not to drive if they have a visual impairment. We have them evaluated by occupational therapist to kind of give them some idea about what to do. A lot of these patients actually go home because they have just primary visual impairment, not really motor or sensory impairment. So they go home and we suggest them to follow up with the outpatient occupational therapist. Okay. Now, depending on centers to centers, sometimes we refer them to the specialized low vision clinic. Not every centers have. There are very few centers we actually have dedicated low vision clinic, which comprises of ophthalmologist, occupational therapist, and sometimes neurologist who kind of work as a team and try to help them improve. And basically, there is no really level 1 treatment for these patients, and most of the recovery is basically compensation techniques. There are some prelim data of using prism, and there was actually a device, Nova Vision, which was approved by FDA, but it didn't really gain traction, and there were conflicting data in terms of usage or recovery or efficacy from the patient side. So that is not the practice usually that we see.